Good morning, everyone. Mark Crowther, I'm chair of the Department of Medicine. These are medical grand rounds, and we have a special set of rounds today. We'll just give people a few minutes to join, as Zoom sometimes takes a minute or two to fold everybody into the meeting. So we'll start in about 30 seconds or so. All right, Mark Crowther, I'm chair of the Department of Medicine. For those of you who are expecting Dr. Azam and or Dr. Verhofstadt this morning, we have a special set of rounds, and I'll introduce the speakers in just a moment. For those who are new to Grand Rounds, you will see that if you want to ask a question, please use the question and answer box. The chat function is working, so you can ask questions in chat if you wish, but it's really hard to track questions in chat usually, so question and answer is better. These rounds will be recorded or are being recorded and will be available on the Department of Medicine YouTube site a bit later, probably over the weekend. So I will now introduce Dr. Lahana Tabani. Lahana is the past acting chair of the Department of HEI, which I still call Clinical Epidemiology and Biostatistics, and is currently the Vice President of Research at St. Joseph's Healthcare in Hamilton, and is, I think everybody in the audience will know, an internationally recognized expert in many parts of statistical methodology, and is also our go-to person at McMaster when we actually need to get statistical work done on studies, because Lahana himself and the people he works with are extremely helpful in getting that kind of work done. So I will now introduce Dr. Tabani, who's going to introduce our speaker, and I will see you all later.
Thank you, Mark. Welcome, everyone. I think people are still signing in, but we'll get started in the interest of time. Well, let me just say this is a special day. It gives me a great pleasure to welcome a great friend, Professor Jimmy Volmink, all the way from Stellenbosch University in South Africa, Cape Town. Jimmy is a friend of McMaster, and as of yesterday, he became part of the McMaster family as a recipient of the McMaster honorary degree. And we are excited to actually host him for this rounds. Let me tell you a little bit about Jimmy. For those of you who may not know him, his resume is big. I'll try and see whether I can summarize it very quickly. He's a professor in the Department of Global Health and served as Dean of the Faculty of Medicine and Health Sciences at Stellenbosch University in South Africa. And this was from 2011 to 2021. Now, I have to tell you one special anecdote about this. This is a university that at one point, while Jimmy was a young man, had denied him admission for medical education because of the color of his skin. But as luck would do it, he ended up actually running the institution. He's the founding director of Cochrane South Africa, which was actually built by the South African Medical Research Council, and is also the founding director of research and analysis at the Global Health Council, which was based in Washington, D.C., and the Tlaxo Wellcome Chair in Primary Care at the University of Cape Town. Jimmy started his career many years ago as a professional, working as a general practitioner, caring for socially disadvantaged communities in rural Swaziland. It's a very small country in Southern Africa. It's now called Eswatini. And he was also working in the townships near Cape Town. Upon being awarded the Harvard South Africa Fellowship, he obtained his MPH from Harvard University. He then went to Oxford, where he got his DPhil in epidemiology. And Jimmy's special interests have always been really about evaluating effects of interventions for high priority health problems, which include TB, HIV, AIDS, and cardiovascular problems, promoting health evidence-based decision-making, engaging in activities aiming at addressing health and social inequities in our societies. They're also working a lot to build research capacity in Africa, which continues to be a major deficiency. Jimmy has been recognized for many of his contributions. I don't think I'll be able to list all of them. Just to give you a sense, he was elected as a member of the Academy of Sciences of South Africa, and he's a fellow of the Royal College of Physicians of Edinburgh. He was also awarded the Liverpool Medal for Distinguished Contribution by Liverpool School of Tropical Medicine. He also received a recognition award for his contribution in evidence-based healthcare in Africa and a President's Lifetime Achievement Award from the South African Medical Research Council. And very recently, Jimmy was recognized by the Catholic University Leuven with an honorary degree in recognition of his work in promoting human dignity and his contributions in science practice to improve health and well-being. And even within Stellenbosch, Jimmy received many recognitions. Just to give you a sense, he received the Rector's Award for General Performance 3 years in a row, 2013, 2014, and 2015. And as he completed his 11-year tenure as Dean of the Faculty of Medicine and Health Sciences, he was awarded the Lifetime Chancellor's Award for sustained excellent career performance. Colleagues, please join me in welcoming Jimmy, whether I can use an emoji, whatever, to make him feel like now he's part of the McMaster family. He's going to tell you a very fascinating story, a must-hear story about his journey in the struggle for evidence, education, and equity. Welcome, Jimmy.
Thank you so much, Lahana, for the kind introduction. And also to Mark Crowther, thank you for the opportunity to speak at the board, to speak on these rounds. I have done talks like this at other rounds, never at McMaster, so it's a very special place, and so I'm particularly honored to be able to do this today. It's really not possible for me to proceed with this talk without just expressing a few words of acknowledgement to this man, Dr. Bongani Mayosi, who is professor of medicine at University of Cape Town and also became the dean. So we overlapped as deans in the two universities, but more than that, he was a very special friend that we worked together extremely well. He also worked with Lahana and other colleagues here at McMaster, and so I know that people will recognize him. And he left us too early, and we miss him greatly. And I just wanted to share this quote written in this contribution that a few of us made in journal after the death of Bongani. I think the critical thing here is as we said, that perhaps one of Bongani's most remarkable legacies is his dedication to mentoring junior clinician scientists and building research capacity in Africa. And this is an area that's so close to my heart, and I know that many of you, and I'll come back to this during the presentation, many of you here at McMaster have assisted in this mission to build capacity and all over the world, but including Africa. And so we're very grateful for that. So let me just say that I also want to acknowledge here some of the pioneers of the evidence-based movement. I remember the excitement with which I first read some of the articles on critical appraisal and then the user's guides to the literature. I embraced the clinical epidemiology book and went through that with my yellow highlighter and was very, very excited about this. I never had the opportunity of coming to one of your popular EVM or prior to that, your clinical epidemiology courses here. But as I said at the convocation address yesterday, it was a pleasure. It was a great pleasure to meet many of you at conferences, and I was really, it was clear that the these pioneers were really bright, enthusiastic, courageous people, very often gifted communicators. But that was not the most impressive thing for me. The thing that struck me the most, really, was the spirit that they carried, the spirit of humility, of inclusion, of generosity, drawing people in, making people part of a team, that collegiality. That was not something I was used to, and it remained made a very deep impression, and left me very determined to try and emulate that in some way. And I'm also very pleased to say that many of the people that we've worked with, who were proteges of these pioneers, are continuing to reflect these wonderful characteristics, and I think that is really helping to change so many things in healthcare research. So thank you for that. So let me just say that the purpose of this talk, if I may put it that way, would be to try and give you, especially those of you who haven't yet been to Africa or to South Africa, a sense of the context in which we work, and help you to understand how evidence and education are helping to advance equity, which is so important. And as I said earlier, and this is a collaborative mission, and we're doing this together, all in a joined up way. And I think it's been the most exciting part of my career to see people who previously have not had opportunities be able to advance in their careers, and receive their qualifications and move on to participating as faculty members. So that's really something that's very important to me. Now, my interest in equity was really related to the fact that I was born and bred in the apartheid era. And again, I know that some of perhaps the younger people might not always know exactly what this was. So just very briefly, this was a policy, official policy in South Africa between 1948 and 1994. It was essentially a brutal system of racial segregation and oppression, which denied people of color their basic human rights. The impacts were multiple, and they would include, really leaving people with deep physical and psychological trauma and scars. It was a violation of human dignity. It deprived people of proper living conditions, which was important for health. It provided inferior education, and importantly, it limited opportunities to achieve people's full potential. And so there were many talented people where the talent just went waste because they never had the opportunity. And this system came on the back of European colonialism and slavery. And that, of course, is true. The whole of the continent was affected by colonialism, and suffers up to today the consequences of that. So that's a very high level sort of description. And I want to zero in perhaps on one example of what it felt like to live under apartheid. And I'm going to relate very briefly a personal tragedy. On the left of this, the picture in the middle somewhere is my sister, Lydia Rose Volmink. And on the right is a friend called Margaret Gustafson. Margaret is an American, and she came to South Africa to teach, and she became a good friend of the family. And she and Lydia one evening went out. It was a Christmas party, so they were on their way. It was a stormy night, and they were involved in a head-on collision with another car. Margaret was the driver, and she was jammed under the steering wheel with multiple fractures, but fully conscious. Lydia, on the other hand, sustained head injuries, and also there was excessive bleeding, and eventually the ambulance arrived, and the ambulance started working with Margaret, and Margaret, although she was in a lot of pain, kept on saying, "Please take her, she's dying," because Lydia didn't look good at all. And they just continued to take Margaret out of the car, and the ambulance then drove off and took Margaret to hospital, leaving Lydia behind. And the reason for that is that it was a whites-only ambulance. Everything during apartheid was segregated, and including healthcare services like ambulances, hospitals, etc. Yeah. On the left there is a stretcher. You can see the words at the bottom. The word is blanca, which means white. And so even at that level, things were separated. The consequence of this situation was that Lydia died. Lydia died that night because there was a huge delay before an ambulance could arrive that could take her to hospital. Now, we will never know for sure whether she would have died anyway, but the thought that she had been left, and I'm sorry that I get a little emotional when I talk about this, but I don't talk about it very often. But those are the kinds of scars that apartheid has left on a lot of people in South Africa. I want to show you this slide. On the left, this is an approach to education. On the left is Hendrik Verwoerd. Hendrik Verwoerd was an apartheid-era prime minister. In fact, he was the main architect of apartheid. And he was also, prior to that, a professor of sociology or applied psychology, I think it was called then, at the university where I work now. And I have been for the last 17 years, the University of Stellenbosch, who also trained most of the apartheid era politicians. And this is what Verwoerd said about education. He said, blacks should never be shown the greener pastures of education. They should know that their station in life is to be hewers of wood and drawers of water. So it was a deliberate strategy to oppress and keep people down. And on the right, Nelson Mandela and what he thought of education. Education is the most powerful weapon which you can use to change the world. Both of them saw the power of education. The one power to deny education is to oppress. The other is education can be used as a tool to uplift, not just yourself, but also to change the world. And I think that's key to this message, this presentation that I'm giving. So, how does education change the world? Here are some pictures of my family. We all grew up during apartheid. The top left is the junior version of myself, the younger one. I think I'm holding a little insect in that little tissue. I was obsessed with insects at the time. And on my right there is my older brother, John. Now, we are the first generation, my siblings and I, of our family that completed high school. And John, because he was older, had, when he was in his final year at grade 12, he had a chance meeting with the mayor of Cape Town because there was a school outing, and he was asked to make a short speech, after dinner speech. And the mayor came up to him and said, "What are you doing next year?" And he said, "Well, I'm going out to look for a job." He actually didn't quite know how to answer that question, because at the time, university, education was not even on the radar. I mean, I didn't know anybody that went to university, and so there were no role models. And the mayor said, "No, have you considered going to university?" And long story short is John got a scholarship or bursary from the provincial department, and he ended up going to a historically Black university in Cape Town, where he did a BSc and with majors in mathematics, applied mathematics, and physics, and ended up eventually with a PhD in maths from Cornell University in the US, and became a professor in South Africa, and but also working for a long time at the policy level, advising on education policy, and at the grassroots NGO level, promoting education to disadvantaged communities. On the right is my whole family, apart from Lydia that we lost, and my dad, who died a year later. My mother is there, and she is is a very important part of our success. She is one that, despite what the apartheid laws were saying, helped to keep the thought alive that you're not defined by what other people think of you, and that you just go out there and do your best. And she was very encouraging of that. My sister is next to her. She became a school teacher. My one brother became an advocate, law, and worked for a long time before he practiced as an advocate, worked in a street law project after the apartheid ended to educate people in communities about their rights. Another brother he works in development economics and works with looking at funding for education in South Africa, and so on. So all of us except one obtained postgraduate qualifications through a long process, a long struggle, but try to really use that to do what Mandela said, use the education to change the world. And we continue to do that. Now, I would just like to say that although it's a positive story that I've told you about how we, my family and some other families overcame adversity, but that is a rare occurrence. And it certainly doesn't represent what happened in most cases in South Africa. South Africa remains an extremely unequal country, as you can see. People live in squalor in many parts of our country. If you don't know what those blue things are in the one picture, those are our toilets. that have been provided, because these people live in so-called shacks that don't have internet, so they have to go, and there's not much electricity in some of these places. And so you can imagine what the implications are if you need to go to the toilet at night, etc. And so, you know, at the bottom right, you know, I always think this is such a good depiction of the approach that is needed to try and change things that are, when things are so uneven, so unbalanced, then, you know, you can't just be talking about equality, where everybody gets treated the same way. Equity is where you really are giving more to those who have less. And that's the only way that you're going to balance things out going forward. And that's why I'm excited about equity, and I think it is making a difference. So, you may know a famous comedian from South Africa called Trevor Noah. Trevor Noah is actually quite a thoughtful person, very wise person, and he's written a book called Born a Crime. And in this book, there is something he said that really resonated with me. He says, we tell people to follow their dreams, but you can only dream of what you can imagine. And depending on where you come from, your imagination can be quite limited. And I find that to be so true. You know, if you work in one of these townships, you meet people who have not a clue of what is possible. I find many of them are really bright and articulate, but you know, apart from the opportunity, just the thought of what they can do with their lives and with their talents is just not there. And so you have to really work from a very basic level. And here are pictures of people trying to, you can see Nelson Mandela's pictures on the wall there, people doing motivational talks to tell people, you know, in these settings, you know, what is out there. And some of us take them out, show them around Cape Town. Some of them have never seen the rest of Cape Town, and so on. And it's, you know, one of the most beautiful cities in the world. We also, some of our students go into the townships, and this particular township is Khayelitsha in Cape Town. And you can see one of our students there doing some tutoring, and so several of our students go there and just help you know, the high school students with the material, because the teachers that they have at these schools often are not very well equipped to do this, and so they need additional assistance with their education. And so that's the level at which you start before you can even talk about university education. But I have to say that I'm thrilled that you know, we are starting to see the needle shifting. I'm just, you know, I'm just going to highlight maybe three things here. One is that the chap that's smiling with the bow tie is Wandile. Wandile came out of one of those townships that I've just shown you, Khayelitsha. His mother was a domestic worker, and he had a twin. In fact, they were twins, and both of them came to Stellenbosch on a scholarship. And they were extremely intimidated in the environment initially, but continued to grow over the 6 years of training there. And they really did extremely well. And both of them now are doing their internal medicine specializations in Cape Town. At the top, there is a group photo of at our home of some of the newly qualified graduates, together with our chancellor on the right, on the left there, and of him I will say a few more things a bit later. And then you can see from the picture, these are the graduating class of medical students, and how you know, the students and the graduates are beginning to reflect the demography of South Africa, and that's really the goal. And I want to also acknowledge the team that I've been working with as Dean for the last 11 years. We've been a very close team, and we have worked very hard to introduce many new things at the Faculty of Medicine and Health Sciences. But one of the things was our transformation agenda. And the transformation agenda really consisted of three things. One is quantitative change. So the diversity that we need. I'm showing you, but that's really just the beginning. Other aspects of transformation would be inclusion. Including people in activities, in decisions, etc. And as I always say, the highest form of transformation is belonging. This is when people feel that this is their place and that that this is their home, and they feel welcome. And so we've been working on that agenda, and as I said, we are starting to see impact. So now I'm going to get into the evidence bit, and I have to backtrack here a little bit. I had the tremendous opportunity of ending up in Oxford to do a DPhil in epidemiology, and during that time, it was due to a chance meeting that I had with a professor from Oxford when I went to Vancouver to do a presentation, and we ended up on the same panel. And we became friends, and a year later I was in Oxford doing DPhil. There I met Ian Chalmers, also pretty much by chance. And I also had my time in Oxford overlapped with David Sackett's tenure there. And so, how can one get more fortunate to have Ian Chalmers and Dave Sackett as people you can sit down with and as mentors? And I was left changed forever. And one of the great things that Ian Chalmers did was that he also introduced me to Paul Garner in Liverpool. And Paul Garner and I have become close friends, and we've worked together for over 30 years very closely in Cochrane infectious diseases, and did a lot of other things in terms of evidence to practice and policy together. So that's been quite an exciting journey. The other pictures there are just other key individuals that helped to get the Cochrane Center up and running. At the South African Medical Research Council, and I just want to acknowledge people like Les Erwig, Merrick Zorenstein, Justus Hofmeyr, all important in this story. So taking Cochrane from Oxford to Africa is not straightforward. It's a very different context. Culturally, and as I mentioned, the colonial history is such that people, have been deprived of really the opportunity for education and skills and capacity. Again, teamwork has been the key. On the left there, you see Nandi Siegfried, who is slicing the cake at our 10th anniversary of the Cochrane Center there, and then at the bottom, myself and Ian Chalmers celebrating there with the 20th anniversary cake. Right from the start, the center was dedicated to not only work in South Africa, but really to spread this message right across Africa. And so we have worked very hard to reach out to other, colleagues, friends, people from other countries, getting them involved in the mission of doing systematic reviews, and then getting those reviews into evidence, into practice and policy. And it's been a really exciting journey in doing that. I stress teamwork, and always in this. And here I just want to acknowledge some really important people on the left, top left, is Nandi Siegfried, Taran Young, and then below them is Tamara Credo, and then Charles Wasonge, and all of them played a key role in building the center and the African network of Cochrane and evidence-based healthcare, and without them it would not have been possible. Charles is the current director of Cochrane South Africa, and he came to us from Cameroon, and he was there was a scholarship, a 3-month scholarship, funding provided by somebody in London who used to was a South African who left South Africa many years ago, Aubrey Shyam, and he created a scholarship for people to go for training. And so Charles was our first recipient of the Aubrey Shyam scholarship, and he then came back to South Africa and started working with us. Yeah, so it really does take a team to have the impact that you're looking for. Let me just illustrate with this example the kinds of challenges that that we had very early on after the establishment of the center. The HIV/AIDS just exploded in Southern Africa, and that was an unexpected challenge. South Africa, the MRC of South Africa said South Africa is experiencing an HIV/AIDS epidemic of shattering dimensions. 800 people were dying of AIDS in South Africa every day. The mother-to-child transmission rate was around 25 to 35%, with more than 70,000 babies in South Africa born with HIV infection. And the tragedy was that the current government refused to provide antiretrovirals because we don't really know why. The truth is we don't really know, but there was a great opposition to a policy of making antiretrovirals available to everyone. We were then left in a very difficult position when the Minister of Health contacted the center and said, we would like you to do a review of the antiretrovirals because we believe it to be toxic, and we want you to show that. We were in an awkward position because the South African Medical Research Council is funded by the Ministry of Health. And so we were being asked by the minister to help her, find evidence that would support, her policy of non-provision of antiretrovirals. Well, we said to her that we're happy to do the review, but we will have to look at all the effects of antiretrovirals, both benefits and harms, and we did. And we found that there was like everyone else had done before, that there was overwhelming evidence that it saved lives. And there were some side effects, but they were relatively trivial compared to the benefits. We presented this review to the Ministry of Health, and we were completely shut out. We had asked for a meeting, they wouldn't talk to us, and so that review went absolutely nowhere. But fortunately, there were others working very hard to try and move government to do the right thing. And there were NGOs, and important one is the Treatment Action Campaign, launched a lawsuit which really forced government, the Court of Law ordered the government then to introduce antiretrovirals. The government still was not very happy. They appealed and lost the appeal. And so they were essentially forced to provide this. And with the change of government now, I mean, it's a different government now, we have in reality ended up having the largest antiretroviral program in the world in South Africa. The gentleman on the left is Justice Cameron, and Edwin Cameron. He was appointed by Nelson Mandela to be a judge on in the Constitutional Court of South Africa, and he himself and he has recently become our chancellor at Stellenbosch University. He is HIV positive, and he uses every occasion to talk about this experience. And he said the tragedy for him was that most people in South Africa who got HIV/AIDS were poor, and they were dependent on government provision of these drugs. He was well off. He could afford to go and buy the drugs, and that saved his life and made him able to continue his work uninterrupted. And he is pretty fine still today. And it's really quite forceful, and it's quite impactful when you listen to him describe the story. And he's written that book, Justice, where he talks about that whole saga. And so eventually you see that everybody rejoiced in the victory, that the drugs were now available to people who need them. So together with Patrice Machava and Merrick Zorenstein, we wrote up a reflection really on this experience because Patrice and I were both involved in the review. And the Milbank Fund in New York asked us to write up a case study of this. And so, a few things we said in conclusion was that evidence, it's possible for evidence to be eclipsed by political agendas and entrenched prior views, that the search for evidence can merely be an attempt by policymakers to bolster their own position. So, quite contrary to what one might think. And that the need for assessing the readiness for policymakers to use the evidence is something which is critical. And then the last thing we stressed was that teaming up with other stakeholders can sometimes be critical. Patients, civil society, etc., to help get evidence into practice and policy. And it's not so this was a wake-up call for us at Cochrane. We had been very naive up to that point, thinking, well, if you provide the evidence, people will use it. And of course, the reality is completely different, as you know very well. And so this is just trying to say exactly the same thing, that this policy-making business can be very messy. That there are things that are interacting, personal experience, traditions, misinformation, expert opinion, and some research evidence on the one side coming into us, through our senses, and then interacting with what we believe to be true, our theories, our values, our biases, and our vested interests. And in all of that, sometimes, people can completely ignore the best available evidence. And so, since that experience, one of the areas, and not the only, but one of the areas that's the Cochrane work in South Africa and in other parts of Africa really concentrated on is policymakers, because they can affect the lives of a lot of people. We have worked with clinicians as well, but the focus has been on evidence-informed policy quite a bit. And there you can see Andy Oxman, and I think that's John Lavis coming. We were a collaborator in a program called the Support Collaboration. tools for policymakers, inviting, having workshops with policymakers and also the civil servants that report to policymakers to try and influence, to try and build trust. And to be humble about it, because it's, one of the things that really struck us is that we, as researchers, sometimes we're a little arrogant, thinking, that we know, because we've got the evidence here, this is the right thing to do. For policymakers, it's much more complex than that. And so we needed to understand their world as much as they needed to understand ours and the language that we use and why we do things the way we do. And that was extremely helpful. The center also put out, lots of guidelines or inputs into guidelines at local level with the Academy of Science, for example, but also with the World Health Organization, providing input into policies that are being made at international level. Here you see Holger Schunemann, and he has drawn us into the GRADE network, into the GRADE collaboration. And South Africa is now, we have a South African GRADE network, which the Cochrane Center and Stellenbosch University are very much a part. And so again, there's another example of the link to McMaster, which is what I wanted to stress here. Andy Oxman, I should have said, for those that don't know this, of course, he was very much linked to McMaster. He was based here before. And Andy Oxman has become, he has remained in touch with us on so many different levels and has been a great supporter on so many things, and an advisor and just an all-time great person, as are all the other people from McMaster that we have worked with. Again, John Lavis here with, more recently, the collaboration on COVID evidence that we're also participating in. The last bit that I want to cover is to say that, so when we started this work, I think it was around 1997, we really looked for anybody that was willing to come and learn anything. And, we took people, clinicians or non-clinicians, into, the center. We provided training, but we realized that, for some of the work that we were doing, as the work was becoming more advanced, as the methods were becoming more advanced, we needed to up the training, and we needed to provide more formal training in epidemiology, clinical epidemiology, as well as biostatistics. So those were two critical areas that we were. So at Stellenbosch, we set up, under the directorship of Taryn Young, the Center for Evidence-Based Healthcare, which was intended to do just that, to conduct research, but also to focus on training. We started off with an MSc in clinical epidemiology, which has become one of the most popular masters in the university. And it draws people from all over Africa. And here you have Marek Smija, and Marek was one of the McMaster colleagues who helped us greatly. Marek came to teach the module on diagnosis and screening, and he came every year for 10 years in a row to help us with that and develop the capacity locally for somebody to take over when he stopped coming. And that's such, for me, a beautiful example of the kinds of things that so many people from McMaster has done, is just to build the capacity for us to be able to do things for ourselves. And I think that's very important, but also then to be able to participate as equals in teams. This gentleman, I think you know as well, and he was the man who really changed the world of biostatistics training for us. He also, more than 10 years ago, started getting involved, and you know, this was a critically deficient area for us. Lahana, first of all, we called a meeting, a regional meeting. I think it took place in Botswana, if I remember correctly. The NIH Fogarty people were present, and we made the case with Lahana helping us greatly with this for increasing biostatistical excellence in Africa. And eventually got funding to do just that. And so this has been going on, in different ways. So, mentorship in biostatistics. Lahana has been extremely helpful in mentoring many of our biostatisticians, but also establishing an MSc in biostatistics. This is Lahana and myself in my office, my old office, and I was dean, and so we had great times. And he also frequently visited and helped us with biostatistics training. The story with Lahana cannot be told without the link to Lawrence Bwagbo. Lawrence, so the connection was at some stage, I was contacted by Lahana and say, we're looking for somebody to do HIV research, a fellow. We've got some funding for a fellow to do HIV research, and asked for a recommendation. Lahana can tell you the details of that because it wasn't as straightforward as that. I think he really had to struggle to make it possible to recruit somebody from outside of Canada, but eventually he did, and we recommended Lawrence to him, and that turned out to be a great success story. Lawrence did so well that Lahana decided to keep him here at McMaster, and but it's the gift that keeps on giving, because Lawrence has not cut himself off from Africa. With and without Lahana, he has stayed in touch. He collaborates with the Cochrane Center, with Stellenbosch, with people in other parts of Africa, and continues to build that capacity. So I'm ending with this slide, just very briefly, to say, just to reflect on, I've shown you a lot of pictures and I'm just trying to put it together. What am I really trying to leave you with here? So the first thing I want to say is that partnerships and teamwork are fundamental for achieving success. And I cannot stress that enough. This idea that, you have some big man or big woman doing everything and getting all the credit for it, is just not the way to go. And I learned that from people from McMaster, from people like Ian Chalmers, Paul Garner, others, just to be generous and include people, and people with talent will come in and, so as Harry Truman has said, a quote on the left, which I like quite a lot, is, "It is amazing what you can accomplish if you do not care who gets the credit." And that's the whole thing. People often want credit for themselves, but I think it's teams that should get credit. I think it's important to have a shared vision and common goals. I think it's important to have a diversity of people and ideas, and I hope I've shown you that through these slides. Age, gender, ethnicity, geography, disciplines, all, everybody has something to contribute. And I think relationships are very important to teamwork. And so, when you, particularly when one works cross-culturally, I think it's important to have humility. West is not always best, and I think we just have to remind ourselves all the time that everyone has a worldview, everyone has talent, everyone has some insights that can be useful. So we need to be open to mutual learning. I think the awareness of resource constraints is important. So, you know, in the African context, often institutions lack infrastructure, IT connectivity, general skills, funding, etc., and that needs to be taken into account in what we expect of people, and it also needs to be taken into account in terms of the capacity that needs to be built. And then back to equity is my last point, the commitment to advancing equity. And at the convocation address, I ended my remarks by saying that this is the birthplace of EBM, evidence-based medicine. And perhaps the time has come now to add another EBM, which is the equity-based movement. And I think it could be a very exciting movement that could include a lot of people from all over the world, from every walk of life. And I think, you know, equity is about shared leadership. It's about, in the research context, it's about participation, you know, of everyone in problem identification, in the conceptualization of the project, in the benefits that accrue, such as authorship, and of course, capacity building, as what I've already mentioned. So that's all really that I'm going to say, and just thank you very much to everyone. And I just want to say those are my grandkids, and Isaiah and Kai, and we miss them greatly, and they said to tell you they say hi. Thanks.
Thank you, Jimmy. That was a fantastic journey with lots of lessons for us to take home for sure. Any questions and discussions? You can use the question and answer for anything you would like to pose to Jimmy, or any comment. I'm trying to monitor it. I don't see anything there. Yeah. Now, Jimmy, I just wanted to ask one thing myself. I mean, certainly there has been a lot of effort, you know, building partnerships across different places with different colleagues around the world. And, you know, Africa remains in many ways to struggle. Was there something particularly challenging during COVID that perhaps you thought, you know, there's still something that we could all do together, or at least it was exposed more by COVID as a major gap that we could all continue to figure out how to deal with?
Thanks, Mohammed. I mean, COVID, I think one can talk a long time about the impact of COVID, because it was not just a health crisis, it was also a humanitarian crisis. And, you know, all of that impacted on people in so many different ways, and will continue to do that. But if I can distill just one thing that I learned from the situation we found ourselves in, when there was a global, you know, we talk about globalization benefiting everybody, and that we're all in this together, you know, and we were all in this storm together, but I realized that we were in different boats and some boats were much more sophisticated than other boats, and Africa was really left behind. We struggled to have access to base, you know, vaccines, PPE, you know, equipment for ICUs, etc. You know, skills to treat patients in terms of just the human resources to do that. And that reinforced for me the idea that aid to Africa is not the answer in terms of giving money, and you know, often that money actually, you know, goes more to the global north than the global south. It is about making Africa, helping Africa to be more self-sufficient in every possible way. And for me, it's really made me more determined. Now that I'm not dean of the faculty, I have more time for this. And so it's very exciting because I really want to give the rest of my time to really, really intensify this effort, to really help, just build capacity in Africa in every way possible so that we are self-sufficient when it comes to dealing with these crises, because we cannot depend on charity when we in this sort of situation.
Thank you so much, Jimmy. Ladies and gentlemen, I realize there's a comment coming on the theme, but unfortunately we've run out of time, and I'm sure you all have somewhere to go. We have a common philosophy in Africa, which many of you would know about. It's called Ubuntu. Ubuntu means I am because you are, or I am because we are. And please join me in thanking Jimmy, because he's been an embodiment of this philosophy in so many ways. And let's figure out how we could all join him in trying to make our world a better place. And thank you so much, Jimmy, for taking the time to share your personal journey. And if there's anything any of us could actually do, never hesitate, as you haven't, we'll reach out to see how we could actually help. I'll give it over to my boss, Dr. Mark Crowther, to close the discussion.
Thanks very much. Great rounds. Really appreciate your time and effort, and also congratulations on the award yesterday. I think lessons for all of us in these. Again, these will be posted on our YouTube channel. So if anybody does wish to see them or is aware of others who wish to see them, probably within the next 48 hours, if you just go to YouTube, you'll find them on the Department of Medicine website. So thanks very much for our guest speaker, and thanks to Lahana for hosting things, and have a great morning and afternoon. Thank you.
Thanks, everyone. Great pleasure. Thank you.